Hello everyone, I'm Dr. Shalini. I'm the founder and chief consultant of Dr. Shalini's Homeopathic Clinic. This video I'm making with an intention to share few details regarding the novel coronavirus. Probably I'll be doing it like an FAQ, that is most commonly asked questions to me by my patients or whenever I conduct in webinars by my students or even by normal laymen. So I have made three important pointers under which I'll be clearing the doubts, frequently asked doubts, or that may be in your mind. We all know about novel coronavirus. It has been affecting our life for past many months. Few of us have lost our near and dear ones, or we have seen some or maybe many who have been affected by it and who have survived, fought the disease, and have come out successfully and healthy. We know that to prevent coronavirus, what all safety measures we have to take, like be healthy, be clean, maintain hygiene, avoid touching the face and nose, mouth frequently, wash your hands, 20-second rules, where we have initially the government and the many pharmaceutical companies and many people have shown videos where you can see the children are singing happy birthday songs and washing their hands, which actually works. So the 20-second of washing hand, sanitizing it, avoiding crowded space, and most importantly wearing masks. uh, this and sharing things, avoid sharing things. Nowadays, once the curfew and the limitations that the government has kept on us has been removed and relaxed a bit, we can see that people are going back to the previous one. But there are dangers regarding to this aspect, which I'll be discussing in this video. So, like I said, I will not be dwelling too much regarding COVID details. Let's move on to the FAQs. The first FAQ that of late that I'm getting is regarding wearing of mask. We have heard that we can use double layer mask. Now, this what do you mean by double layering mask or using double mask is not wearing two surgical masks. Surgical mask is a mask, blue color mask which you give. That's a disposable mask. Do not wear two disposable mask together. When we are being saying using double mask or double masking, it means wearing a cloth mask, on top of that wearing the surgical mask. And while you are wearing the surgical mask, you have to do knotting method. Knotting method is by the end of the surgical mask, you will have an elastic band. You can see a picture, I'll just show you there. And you have to just tie a knot at the end before you put it behind your ear. Okay, that is knotting method. Knotting method is very highly effective method, so that there is no space left for the air to pass on. So the first thing is doubling mask is where you use a cloth mask, normal ordinary cloth mask. On top of that, you use a disposable mask using the knotting method. And the second most important thing is please do not use double mask when you are using N95 mask, because N95 mask already provides you the protection. So if you do the double layering or doubling up of mask with N95, it will be difficult for you to breathe. So that is a deterrent for using continued usage of the double mask. That I hope I made it clear. N95 mask, you're not at all required to. You're not supposed to use another mask or another layer of mask of protection. N95 is itself suffers. Now that was regarding the mask thing. Even while you're handling the mask, basic things follows up. Do not use frequently used up mask. Once or twice or maybe 3 or 4 times even the cloth mask is being used. Once you feel that the cloth mask has started to get untidy or unclean, you have to use another one, new one. Same way, disposable masks are supposed to be disposed, use and throw. Once use it and then please do dispose it off. Now the second, that was regarding the mask. So now the second thing is regarding the vaccine. The most frequently asked questions to me by my patients, like I said during my webinars, are regarding vaccines. A lot of doubts they have. So of that, the most relevant thing which I feel, relevant doubts which I feel, I'm just sharing here with you. First one is, can I be normal? Can I go out once I've been vaccinated and be like how it was before novel coronavirus has come? Mingle and go and meet my relatives and all. The answer is no, because studies have shown that even after the vaccine, you may get COVID. Yeah, however, it may not be as severe or it might be asymptomatic also, but you may get COVID. So you can't just, after 2 shots of vaccine, you can't just mingle always to every place. Second one, you can mingle with people who have already been taken a vaccine or they got their both shots with a certain relaxations. However, it is always better to be safe than sorry. So please maintain the necessary precautions during, even after the vaccination, double dose of vaccination. The second doubt that I get is, how sooner will I get the immunity? Immediately after first dose, do I get immunity, or do I have to wait till my second dose to gain the immunity? Yes, usually the immunity gaining period is after 2 to 3 weeks of getting the vaccination. So only after that, it spikes up, the body gets activated. The way I can make you explain is like that. Protection against this virus, and by the second dose, the whole immune system is now equipped to fight to a certain extent against this virus. Now, I think that is most important things regarding vaccine that have been asked me, and regarding whether age limitations, or pregnant, whether I'm diabetic and can I take it, I'm having fever, I'm having cold. So for that, all those conditions, autoimmune conditions like diabetes or any other condition, or thyroid conditions, even heart complaint, these people are high risk categories. They are the one whom the government had actually asked initially to get vaccinated. So definitely, without fear, all these people can get vaccinated. Even pregnant women can get vaccinated. For the healthcare provider will guide you, will let you know, to checking your BP, checking, asking relevant questions, and you may get vaccinated. Now the thing is whether kids can, the younger children can get vaccinated or not. For that, unfortunately, as of now, we have been, the government of India has dealing only till 18 years and above. Sure, they are by the next phase of vaccination drive, they will most probably include below 18 also. Now, regarding this vaccine, these are the doubts. The another thing that I would like to mention is the third wave that is about to come. It is the AIIMS director himself has predicted it to be coming a bit sooner than that what they have been expecting. So what is this third wave? It is by the same virus, but a variant of virus. This variation happens because of mutation. Virus mutates. So this Delta plus virus variant is what is being expected to cause this third wave, upcoming third wave. Now the government is doing its maximum by their vaccination drive to make it less impactful. So, but we as a public have a responsibility to manage and maintain the same safety protocols that we have been following continuously till we win over this tide of novel coronavirus and their variants. So the safety measures are the same as before, like we have to wash our hands, 20-second rule applies, avoid touching your face, avoid sharing foods, maintaining safe distance. I'm just repeating the same thing so that we understand that nothing has changed. It's the same thing that we have to follow. The only thing is maybe doubling up of mask. So wearing double layer mask will be beneficial for people who have to go out and work in places. That will be effective and act as a purifying filter type of thing for people who have to work out in one way or another. Now regarding diet, what all things you can have during this COVID period. There are two different diets. One when you're getting affected by COVID or novel corona, or another to remain healthy. all the healthy foods we can have. Indian food, basic Indian food is rich source of basic nutrition and what all things are that we are genetically capable of digesting, and which our immune system is equipped to be recharged. So like ginger, including garlic, having cauliflower, having lots of green leafy vegetables, papayas, all these things are good for health. All carrot juices, like basic healthy balanced diet, if you follow that, that is more than enough for you to being healthy. And the most important thing is keep in check with your mental health. A lot of stress and strain may occur, may not be to you all who might have to work around, work out and mingle with others, but there are a chunk of people or public or near and dear ones who are still staying at home and taking all the necessary precautions, because you can't just simply go out and walk out like before. So there are certain mental health issues that may crop up. So for that you have to have a healthy exercise regime. You can practice half an hour of exercise per day, yoga or normal exercise, mind relaxation, meditation, always having someone to talk to, your near ones to talk to. Keep in touch with your near and dear ones, because eventually that's what matters. Eventually our safety, our well-being, our family well-being is what it matters. Finally, I would like to speak regarding the alternative system of medical stream, Ayush department. Like the mainstream of medicine, the government has initiated this vaccination drive and all. This Ayush system comprises of Ayurveda, Siddha, Unani and homeopathy. So the individual medical stream have their own immunity as well as prevention and management protocols. So as a homeopath, I would like to put forth that homeopathy department also has a lot of immunity boosters that we provide to the masses and the public for their health and safety. Apart from this, the post-viral condition, that is a convalescence period, is where our role is important. This convalescent period for this particular condition is of a longer duration as compared to other viral conditions. So all those fatigue and tiredness, body pain, headache, any other things that is part of this viral COVID-19 viral affection can all be managed effectively under homeopathy. So this I would like to put forth to you all. So I hope that I have cleared most of your FAQs that you have thought about, or you had doubt about asking a healthcare provider and clearing it up. So thank you for watching this video. I hope you all take care, stay safe, and let us all together fight against this COVID-19 and tide over it successfully. Thanks a lot.